cover those visits for physicals, and we encourage anyone that has any type of insurance plan to take advantage of that, because any disease can be managed and possibly cured if they go ahead and have it detected at an early stage.
Very good. You know, Mr. McClellan, I think one of the things about the sickle cell disease that you mentioned about 3 different times when you were talking about it was the pain that is generally associated, which is, I think you also said that this was the hallmark, really, of the disease. Talk about that. I mean, what has been done in order to help deal with that as an issue, with the pain issue and with some of the other, and where is the research in reference to that at this particular time?
During the entire time period I've been at Meharry, I've seen the different trends come and go in terms of treatment, possibility of a cure, and you constantly see in the paper that someone has developed some new compound to fight sickle cell disease. Well, in terms of treating pain, of course we have to use painkillers. We encourage our patients to drink fluids because that expands the liquid portion of blood and tends to force those clots out of the circulation. However, in the past few years, there's been quite a bit of research in certain drugs that will prevent the cells from sickling, and one of these drugs is hydroxyurea, which has a lot of potential in terms of increasing the person's red cell ability to carry oxygen, and therefore they're less likely to sickle. But it doesn't work in everyone with sickle cell disease, and it's only given to those who have severe sickle cell disease. There are a number of other experimental types of therapies that are not widely available to everyone with sickle cell anemia especially, and that is bone marrow transplants. There have been about 100 of them done on various patients here in the United States. Some have done well and responded well, and in essence have had their sickle cell disease cured. But not everyone is a good candidate for that.
For bone marrow.
Right.
And so it is possible to talk about finding a cure, even within that limited framework that you've given us there with just the bone marrow, that there is a possibility of a cure. And then
another is gene therapy, where they can actually go to the genetic level and alter the gene by replacing the defective gene with a normal working gene. And if that succeeds, it looks very promising. They've done some things in the laboratory. In one particular genetic disease called cystic fibrosis, they have done gene therapy in several patients, and however the person reverted. So,
you know, within the framework of finding a cure for that disease, what are some of the physical and perhaps outside of pain, what are some of the physical and perhaps even mental manifestations of sickle cell? How can a person who might not be able to feel your pain, how can a person determine whether or not a person is affected by this disease? What are some of the physical things? Are there any physical things that we can see that...
Well, sickle cell disease is such a varied group of disorders. For one thing, one person may experience the full range of symptoms. Another may have a milder clinical course. Infants who are born with sickle cell disease are at risk for early death from severe infection. And immediately after birth, usually by the time they're 3 months of age, they're on penicillin, which is an antibiotic, and they have to take it twice a day for the first 5 years of life. This keeps the level of bacteria down in the bloodstream, and they're less likely to become ill or die from a severe infection. As they get older, they're at risk for increased pain, and each time they have a pain crisis, there's damage to the area where the crises occur due to a lack of oxygen being received by that. This can lead to further tissue damage and, as they get older, even organ failure. However, not all patients or persons with sickle cell disease experience the same symptoms to the same level or degree of severity.
And so the one thing that sort of characterizes it all is this whole idea of pain, that if you have it, you will be impacted by pain.
At some point, yes, if you have the disease. If you have sickle cell trait, no. We have approximately literally thousands of people who are carriers and are not aware of it. So they don't have the same types of, any of those problems that we've talked about that are associated with sickle cell
Very
anemia.
good. You know, Mr. Lester, we're coming up to our second break, and after which we will have you to talk about what we consider another very, very important minority issue, and that is the issue of sexually transmitted disease.